Good afternoon, doctor. So today, the 29th of November, the result of first round of allotment for Karnataka came. So the two mock results were already known to you. Based on that, many students changed their preferences, and so in the final result, things have become a little bit tight compared with what the mock allotments were suggesting. So we have with us the complete result, as you can see. So let's see. Uh, let's say for each category what is the cutoff. We'll also find which is the most popular branch for each category. So moving first of all to the 1G category. So we'll not spend time explaining the meaning of these categories. By this time you already know which category you belong to. So for the 1G category, the most popular branch this year was MD radio diagnosis, and we might not have time to do this activity for all the branches for all categories, because Karnataka has a hell lot of categories. But at least for the initial few popular branches we can do this. We can look at the details. So 1G and radio diagnosis, the cutoff rank is 6268. So if we go into the details, then for 1G and for MD in radio diagnosis, you will find that the cutoff as expected, the college that finished earliest is KIMS Hubli. It finished at All India rank 1778. Then we have Kempegoda finishing at 6268. Similarly, in 1G, the second most popular branch this year was dermatology, which finished at 6439. And once again, looking at dermatology, so SS Institute is the only institute situated in Devnagari, which has this branch. And so the cutoff rank here was 6439. Similarly, you can see for all the branches for medicine 6897, then pedia, the fourth popular branch in 1G category, and so on. So we know you are searching for your category, so we'll not waste much time going into the detail. So coming to 1H category, most popular branch this year was pediatrics. So again, going to some details in the 1H category, and if you just talk about pediatrics, so clearly this 9220 cutoff, it corresponds to Vijayanagar Institute in Bellary. Second most popular branch within the 1H category is MD radio diagnosis, then of course dermatology. So I would say whoever got derma at 12,309, I would consider him or her lucky. This was not expected to go this low, but luck also plays a role in counseling. So OBG going at 19248 and so on. Non-clinical branches then finishing at 86,001. Coming to 2AG category. So surprisingly here the most popular branch is ENT. But if you look into the details, you won't be much surprised. In the 2AG reservation, very few clinical branches are there. So that's why this trend you are seeing. So psychiatry is emerging as second most popular branch. Coming to 2BH, so you have all the cutoffs. I'm sure you can take screenshots, which might help you in future to decide your strategy and to know the popular trends these days. So 2BH. So conventionally, the general medicine has been the most popular branch in this category, and that is happening this year also. Cutoff 2900. If we just have a look at 2BH and then general medicine. So 2BH and branch we are selecting now general medicine. So it is ESIC Gulbarga where the last seat was taken at AIR 2900. Similarly, surgery, ophtha, ortho, we find that overall the clinical branches ended at 42564. Then within non-clinical, community medicine ended at 71,000 and odd rank. Now you can see for 2AH category. So let us avoid over explanation at this stage. So already you know, if a category ends with H, that means it is for candidates who belong to the Hyderabad Karnataka region, or what is popularly called these days as the Kalyan region, Kalyan Karnataka region. Moving to 2BG category. Now there is lot more competition in 2BG. Reason you know. So in 2BG, dermatology ended at 1665. Looking at some details. So 2BG category, and then if we look at, let's say, all the available colleges and all the courses, so that doesn't give us a good idea. Let us select course by course. So here dermatology is available only in KIMS Hubli. So the limited availability is one of the reasons why it finished so early at just 1665. Then in 2BG, second most popular branch is of course radio diagnosis, which finished at 3881. And if we see regarding radio diagnosis within the 2BG category, then Mysore Medical College, MMCRI, uh, radio here finished at just 265. So you can imagine the reputation of this college and the demand for this branch. Then SS Institute Devnagari, here medicine finished at, radio diagnosis finished at 3881. Now moving to more categories. So next we are having the 3AG category, and again limited availability of branches is there for this category. But of course, they have more than compensated it by the fact that the open category is the one for which everyone is eligible. So no derma here, no medicine here, but we have sorry, derma is there. Derma is there. My mistake. Sorry. Radio diagnosis also there. So you have the cutoffs. Moving to now 3AH. Here are some limited number of branches as we can see along with the cutoffs. So 3AH. Let's see why dermatology finished so quickly. So 3AH, and if you select dermatology, then the reason is clear. In this category, dermatology is only available at Vijayanagar Institute, Bellary, finished at 1021. So after 3H, these are the cutoffs for 3BG. So a bit of a long list here as expected. So you can take the screenshots if you like. Radio diagnosis emerging as most popular branch among 3BG candidates, then followed by derma, followed by pedia, and then medicine. OBG again in great demand, 9488. So we'll scroll to the non-clinical branches also, which finished at 1,30,940. Next in line is 3BH, and across various categories, broadly, the choice of the top three branches has remained consistent, subject to availability. So, for example, for 3BH, there is no reservation available for dermatology. Similarly, radio diagnosis is missing. So, it was expected that these surgical branches, general surgery and OBG, they are at number 2 and 3. Moving to GM category. So here again, derma at number 1 finished at 3189. We have radio at 5347. MD medicine finished at 7071, and so on. So proceeding further, radiotherapy is also at number 6, and not a surprise. Radiotherapy, even at national level, even at INICT, you will see even radiation oncology is in great demand. So moving further, uh, after all the major clinical branches were over, then diploma in medical radiotherapy was in demand. So even at rank 30,000, a GM candidate is not able to get diploma in medical radiotherapy. Such is the level of demand these days. Then after clinical branches, as the trend goes, we opt for patho, which finished at 46,363, and then the non-clinicals drag all the way till 1,35,406. The next category is GMH. So, looking at the ranks, we can see that they are getting the advantage of some limited advantage of residing in this Hyderabad Karnataka region. Next is for GMP, as expected. The cutoffs have come significantly down because of this last alphabet P. So, coming to GMPH, these are the cutoffs. Next in line, we have the category MA. So, this is the beauty of Karnataka. This is also the complexity in a sense that there are these linguistic minority seats, then there are religious minority seats, there is region based reservation also. But overall, it benefits everybody because of the large number of available seats in Karnataka. So, next is MC category. This is followed by the ME category. So again, across the various categories, trend hasn't changed much. Derma, radio, medicine, they are in demand, followed by the evergreen branches, OBG, pedia. These are cutoffs for MEH. Next, we are having category MM. So we are not elaborating much. We know at this point you are just looking for the cutoffs for your category. But as we showed you, we also have the college-wise, branch-wise cutoff. So if you want those, you may just send us a WhatsApp message on the number above. So MMH category, as you can see, MS Hoftha, just one branch available. And why so? Reason you know that looking at this MMH category and then looking at all the available branches, so just one branch is available, and Oftha is available at Khwaja Banda Nawaz University, FMS Gulbarga, cutoff rank 105, sorry, 104348. So after MMH, let us proceed to next category, which is the MNG management quota. So the fee structure here is go significantly up, and so you find ENT finishing at 45,000. Look at how much gap is there between number one and number two. Psychiatry finished at 71388. So then, of course, the non-clinicals go all the way till 1,37,630 rank. Next category is MU. So cutoffs are in front of you. Now going to NRI. So 15% seats are reserved for NRI candidates, and 15% is a big number. So, you know, in this quota, let's say, even the slightly low ranking doctors get good branches. So, somebody getting off at 111 or psychiatry at 1,11,000, even OBG radio at 1,11,000, 1,13,000. So, that's the beauty of our system, I guess. So, money makes the mayor go. Anyhow, moving to open category. So again, MD in physical medicine and rehab finished at 21,097. This comes to me as the first genuine surprise in Karnataka selections. How come this so-called lower clinical branch finished so early? So let us check. Let us check. Just to be double sure, we are, by the way, 100% sure of the accuracy of our data, so nothing to think of that aspect. However, just for clarification, moving to this open category and moving to MD in physical medicine and rehab. So it is available just at St. John's Medical College. So the reputation of this college justifies why this relatively less demanded branch finished so early. In fact, it finished at number one. Emergency medicine at 26,878. So I'm sure you are following the complete video. Please don't scroll randomly to some place and check the cutoffs, because you might miss the discussion which category we are talking about. So we have all these cutoffs for open category, and scrolling to all the way to these non-clinical branches. The next in line is P1G, again available at very limited places. So P1G and general medicine finished at 50010. So looking at now general medicine for P1G branch. So it is available just at KIMS Hubli, and hence we find it finished so early. So after P1G, next is P2AG. Just two branches available, but both are cream branches, radio and general medicine. Next is PGM. So again, some good branches here. In fact, there isn't any non-clinical branch at all. Then we have PGMH, again Derma and Pedia. We have PSTG branch. General medicine finished at 1,31,240 in this category. Next we have RC1, and the cutoffs are in front of you. Moving now to RC2, then RC3. So here we see the competition. So MD dermatology finished at just 1507. Radio finished at just 4093. OBG finished so quickly at 5167. And same thing you can see for all the branches. So in fact, above anesthesia, you see the top clinical branches finished at 10,715. Next category we are having is S1G. This is followed by S1H. So dermatology in maximum demand here also. Then we have S2G, where if we scroll down, the trend is again radio in maximum demand, followed by derma, medicine, pedia, and radiotherapy. So scrolling down, the last seat of non-clinical branch pharmacology finished at 1,33,655. Then we have the S2H category, followed by S3G. Here also you see intense competition, especially for dermatology, which finished at just 1564. So scrolling down, the cutoff for non-clinical in this category is 1,31,979. Next in line is S3H, available at very limited places, followed by STG, and in the end we have the category STH. So we hope that these cutoffs might help you decide your strategy. So we at VidyaSaarthi are always there for anything you want. As of 2025, our Karnataka slots were counseling slots were over in October itself. So kindly do not call for paid services for Karnataka. We do have slots open for all India counseling, as well as INICT. So we wish you best of luck for everything. Thank you.